When you have a senior pet, it's very important to visit your primary vet regularly for checkups. I strongly advise to perform blood and urine checks at least yearly and to do less invasive checks every 3 months. It's also very important to keep an eye on their weight to spot a downward trend quickly. I scheduled in an appointment with our favorite local veterinarian, Simon, at the neighborhood vet. He is an ISFM advocate, and you can really tell by how he approaches his feline patients. Even though Lewis has recently turned 17, he can still be quite spicy when you need to take his blood. In the past, multiple nurses have piled on top of him, taken him to the back of the surgery in the hope he would allow a blood sample to be taken, and fully sedated him, but Lewis would still hold strong. Fortunately, we now know of the power of gabapentin, and because he already receives this medication for his osteoarthritis, it's very easy for me to give him a bit extra the morning of the consultation. Mind you, he only gets a high dose when we need to take blood. He doesn't need it for a less invasive checkup. Gabapentin is a pain relief, but also takes away anxiety and makes pets a bit more mellow. When you give a higher dose of the drug 2 hours before the consultation, they are very easy to handle when at the vets. There's no need anymore for the stress for either of you. Ask your veterinarian about this magical drug if you have a spicy or fearful pet, so that you can make the vet visit a lot less anxiety-ridden. Our consultation is booked at 10 a.m, so I give Lewis his high dose of gabapentin at 8 a.m. After this, he has breakfast and a pee. Because we also want to check his urine for kidney function, I had prepared a special litter box with cat core the night before. These are tiny plastic granules that feel like cat litter but don't absorb liquid. Here you can see how I can easily use a pipette to take the urine and put it in a test tube. I then store it in the fridge to prevent excess bacteria growth, which can give a false result of a UTI, until I leave for the clinic. I use an easy to open carrier to take him to the vet. I then spray the carrier with pet remedy spray to make sure he continues feeling mellow. At 9:30 a.m, we leave the house to leave enough time for him to settle in the waiting room and for his heartbeat to slow down before the checkup. Fortunately, there are no shouty dogs in the waiting room, but I still like to place him in a dedicated cat cubby to keep him as calm as possible. This cubby allows him to see me, but nobody else, and more importantly, no other animals. There's also a featherweight diffuser plugged in near to the cubby, so the pheromones continue to keep Lewis calm. After 15 minutes of calmly waiting, we get called in by Simon and enter the consultation room. Simon knows that with Lewis it's important to get the whole taking blood out of the way as soon as possible. Of course, first he chats with me and asks how Lewis is doing, and then we take Lewis out of the carrier. It would have been better if the carrier had a top that could be removed from it for easy access to Lewis, or if I would have used the larger side doors, but there you go, we're not all perfect. As you can see here, I hold Lewis just like I promised him. I always tell him what we are going to do and that we'll be home quickly. I believe he knows I have his best interests in mind, so he stays calm, and together with the heavy dose of gabapentin, it's easy to take Lewis's blood. Simon then checks over his whole body, heart rate, eyes and ears, and discusses with me what kind of blood and urine check he's going to do. He also advises me to perform a blood pressure measurement at home. Not because he feels that something is up, but because it's generally good practice to do this regularly with aging cats. We're back home within an hour of leaving, and Lewis has a severe case of the munchies. I take this opportunity to clip his nails, cut the fur from between his pads on his back paws, and because he normally doesn't like me touching his paws. With his sedation though, he minds less. Unfortunately, Lewis is not allowed to go outside for the rest of the day as he is on a heavy dose of gabapentin, but he is allowed to eat and snooze for the rest of the day. And while he's doing that, I make sure to file the vet's invoice with Lewis's pet insurance and wait for them to pay the cost back within a few weeks.